So welcome back to We Can Survive. This is Wendy.
This is Pika.
And we're here today to talk to you about surgery.
Yes.
There's lots of questions around surgery for breast cancer. And there's no right or wrong way to do it. And there's no particular order that's preferred. You need to discuss that with your surgeon and your oncology team. And think about what's the best thing to do for you. A lot will depend on the size of the tumor, what stage you're at, and your personal preferences about whether you would like to have a mastectomy, a lumpectomy, or whether you would like to do breast conservation. So there's lots of different options. Wendy and I will talk to you about what we did. And again, there's no right or wrong here. We're just sharing information. So Wendy, why don't you start with how you decided and when your surgery was and what kind of surgery you decided to have?
I had a breast conservation surgery. So I saw my breast doctor. My first criteria is that I do not want a mastectomy. So she says that, okay, and she doesn't encourage mastectomy as well. She showed me the data and, on the survival rate of people with breast conservation and people with mastectomy and how much difference and things like that. So I had to go through 12 rounds of Taxol first.
So you did 12 rounds of chemo and then you did your surgery.
Yes.
So it wasn't surgery first.
No.
Why did they do that? They wanted to...
Because they need to reduce the size of my tumors. I have 2 tumors and 44 lymph nodes infected. So they need to reduce the size. If not, we do not have enough muscles to put it back into my breast,
right?
To fill the void where the tumors are.
Right.
So I had my surgery on 4th January 2018, 3 weeks after my last session of the first round of chemotherapy.
Right.
Yeah.
Okay, so the whole point being was that they wanted to see your tumor's reaction to the chemotherapy, and then they wanted to maybe shrink it some so that there wasn't such a big hole in your breast at that point. And so you had breast conserving surgery. Is there a reason why you didn't want to do a mastectomy, or?
I do not think that I have the mental capacity to live with one missing breast. Yeah.
Okay, fair enough. You know, I mean, these are all things that we all make personal choices about. For me, cutting off the breast was like, I couldn't wait to get rid of it. I was like, take it away. The betrayal of the breast was a bit too much for me. I was like, cut it off with its head, you know, that kind of thing. And when they asked me about reconstruction, I was very quick to dismiss it. And one of the nurses was asking me at that time, are you sure you want to dismiss it so quickly? You might feel differently later. I know myself, so I pretty much knew that once it had gone, I would be like anything in my life that has pissed me off. To hell with it. Goodbye. I never want to see it again, and I certainly didn't want another lump of fat on top of it, obscuring my view. Right now I have a very clean view of where my scar is, and I was like, I want to keep an eye on you. Make sure nothing else starts to grow there. All personal choice. I wasn't particularly worried about mastectomy the way that I was worried about losing my hair, for instance. You know, that was much more of a concern to me. So, you know, there's no judgment here. I think Wendy and I, our message to you is about surgery. Don't rush. There are many options to consider. You can have a mastectomy. You can have a lumpectomy. You can shrink the tumor first with chemotherapy. Then you can do a lumpectomy. You can conserve as much of the breast as you want. There are things called skin sparing and nipple sparing mastectomies, where they will just scoop out all the breast tissue and leave the skin and the nipple there so that they can refill it later with an implant or with your own tissue. There are many, many options. It's about how you feel as a woman, as a girl. I don't think one size fits all at all. The most important thing about surgery is that feel comfortable when you're doing it. So if you have any questions about whether you're going to go for a mastectomy or a lumpectomy or a breast conservation surgery, feel free to email us down below at We Can Survive, because it's a huge topic and it's different for everyone. Purpose of our video was to share our experiences, but everyone's experience is their own. No one can do cancer for you. You have to do it
for yourself.
Your way.
Yeah.
So feel free to email us with any questions.